Greetings from the World Health Organization, and thanks for this opportunity to be with you on a virtual way. No doubt, 2015 will be the year for environmental health, and we are very conscious of that. In September, hopefully, the Sustainable Development Goals will be approved and endorsed by the countries. Before December, hopefully, again, we will have a good treaty on climate change. And in fact, for us, this treaty on climate change, if the countries decide to reach that agreement and go for something ambitious, for us, for the public health community, this will be more than an environmental treaty or an economic or a social treaty. It will be a fundamental public health treaty. But before all of that, now in May, there will be a very important discussion here during the World Health Assembly by our ministers of health. There will be a discussion around a resolution on air pollution and health. And let me tell you, this is becoming now probably one of the biggest challenges we have in public health. We have every year more than 7 million deaths caused by exposure to air pollution. And the diseases for which this exposure to air pollution are responsible for are cardiovascular diseases, which is something that we didn't know before. So we are talking about very chronic diseases that definitely will represent a major challenge for any sustainable insurance system or for any sustainable way to support our health systems. The epidemic of non-communicable diseases that we are all facing now, all countries from developing to very developed countries, needs to provide services to all of those chronic diseases that will represent not only a major suffering for the patients, but as well a difficult and a major challenge to maintain and sustain the coverage of the good health we want to provide to those patients, and obviously a challenge for the health system in terms of sustaining the coverage for that and the cost that it will be represent. Therefore, there is a way to address all of that, which is primary prevention. We need to make sure that we address and we prevent those non-communicable diseases by having urban areas where not only force us, our new cities, to be on a very sedentary lifestyle. We want to be more active and being able to walk, being able to use a bicycle if we want. We want to have a better public transport system that will promote a less sedentary lifestyle and less dependence on our private car. That will be a major way to prevent most of the non-communicable diseases we are facing today. Another one will be prevention of obesity and overweight by promoting a better and healthy diet, and by making sure that we create an environment where our citizens will have the opportunity to have access to fresh fruits and healthy vegetables as well, and not only be surrounded on an urban environment by food that might not be the most healthy one. So by tackling air pollution, by making sure that we detect and we prevent in advance the non-communicable diseases, by promoting again this culture of primary prevention, by having an active role on those major decisions that will be taken this year, like air pollution and health, or like the Sustainable Development Goals, and the climate change, I think we will be doing a lot for the sustainability of the financial system for our better health for our citizens. Thanks for this opportunity, and I'm sure that this roundtable will be a fantastic occasion for exchanging views and hopefully promoting something very ambitious and very visionary for the future. Thank you very much, and again, on behalf of WHO, thanks for the opportunity.